Well, listen, we're going to talk about modalities. I'm asked to give this lecture around the country a lot because most residency programs don't have a professor who wants to give this talk. They all say, let Braddom do it. So that may be what happened here. But anyway, we're going to talk about it. The modality was actually how our field got started in many, not the rehab part, but the physical medicine part. So it's kind of historic. Let's start off with the prescription. And because you're supposed, as physiatrists or physiatrists, you're supposed to be able to write prescriptions for various kinds of therapies. Now, in the old days, when you came to take your board, back when the board wasn't scripted, we would often take a prescription pad with us and hand you a prescription pad and say, write this physical therapy prescription. We don't do that anymore because it's a scripted test. But the point is, you need to know how to do this. This is a case, a 48-year-old construction worker complains of having severe left shoulder pain for 6 weeks. He's been off from work and has basically only taken an NSAID. He has intentionally babied the left upper limb. Now his complaint is that his pain has gone away, but now he's lost at least half of his normal left shoulder range of motion. This is a classic case of what? Yeah, sure. So this is whatever he had originally, that got better, and now he didn't use his shoulder for a while, and the shoulder capsule will shrink very quickly. His did, and now he's lost 50% of the range of motion. So what we're going to do for this man is we're going to give him, this is what you have to do. There's about 6 things you need on every prescription. And one of those things is the diagnosis. The diagnosis, shoulder capsulitis, frozen shoulder. The modality, well, in this case, I would like to use ultrasound. So ultrasound we're going to be using, and now what about the location? We're going to use the ultrasound over 3 ports, anterior, lateral, and posterior. Ultrasound, as you'll find out in this lecture, does not go through bone. So if you want to heat up all parts of the shoulder capsule, you have to use 3 different ports. Intensity, well, for ultrasound, we're going to use 1.5 watts per centimeter squared with stroking technique. Duration is going to be 7 minutes, and the frequency is going to be 3 times a week. Followed by, the ultrasound is just to heat up the shoulder, then it's going to be followed by active assisted range of motion. So the whole prescription is going to be like diagnosis and then ultrasound 1.5 watts per centimeter squared with stroking technique to anterior, lateral, and medial ports of the left shoulder, followed by active assistive range of motion toward normal range of motion. Now, what you do is then you put precautions. Okay, this person's a young person that doesn't have any precautions, but you don't have to write down, watch out for falls or something like that. Now you say, well, gee, we don't do that where I'm from, and I don't either. The reason is because where I work, I know all the physical therapists, I know what they do. But if I send a patient out to some place that don't know anything about the physical therapist there, I might still write it out like this. I also put in there a little line that says other as indicated, because they all have their own little pet treatment they like to do. And if I don't do that, they'll call me up and ask if it's okay if I do that. All right, so this is what we ultimately ended up doing. And we'll talk about why we use that particular one later on when we talk about ultrasound. The modalities now are less popular in PM&R than they used to be. The physical medicine part of our field was originally all modalities. And Dr. Cruzen, for example, invented many of them at the Mayo Clinic. And keep in mind that that was before antibiotics. So in Dr. Cruzen's original book, my textbook is actually the old Cruzen textbook. It's just a more modern version of it, and same company. And that Cruzen textbook, if you read it, it talks about things like how to treat pelvic inflammatory disease using a metal pessary and microwave. Well, we don't do that now, we have antibiotics. But before they had antibiotics, they had to do physical things for treatment. So unfortunately, along the way, a lot of those modalities got labeled shake and bake. Everybody said, oh, you're a shake and bake artist. And so that caused us to not do them so often, which was a problem. And also we had a problem is that few physiatrists now are doing modalities research. We've all gone into other kinds of research. We're still doing research, but not so much on modalities, which is a problem. And also physical and occupational therapy became more interested in the patients doing active things like exercise rather than passive things like modalities. And that was appropriate also, but again, it went too far. Modalities are still useful in many cases.